welcome again. You are from China, right?
Yes.
Okay, nice to meet you.
Okay.
Can you, now we diagnosed you as a chronic prostatitis after our prostate massage. Can you tell me what was the reason you are coming to me? What was your complaint?
Because I urine too frequent.
Your frequent urination, right?
Yeah. And I cannot sit long time. After like 30 minutes, my
Irritation?
will feel pressure.
Pressure.
I want to urine. Yeah.
So when you sit 20 minutes, 30 minutes, you feel irritation and you need to go to toilet again.
Yeah.
How many times a day were you going to toilet?
Let's see, if there's depend. If I sit a lot, I
Yes.
sit down long time,
Yes.
like every 30 minutes to 1 hour.
1 hour.
If I stand or
Yes.
I walk around,
Yes.
maybe every 1 hour.
So you forget about it when you are working, or maybe you are losing water when you are working.
Yeah.
So it is better.
Mm.
So these patients usually they are better at night time when you are sleeping. Do you wake up at sleeping after?
Yes.
How many times?
Like 2 times, 3 times.
2,
in the
3.
night.
Okay, it is really irritative. It is not the quality of life decreases very much with these kind of diseases. So you go to doctors before me, right? How many doctors about this subject you see?
For the past 2 years, like 5 doctors, 2 offline, 3 online.
Online. Okay, 3 online and 2 offline. You go to 2 doctors and 3 doctors. You had online interview.
Yeah.
And usually, previously, when I learned this disease, before I learned more detail, I was thinking, okay, there may be an infection. Let's do a urine test. And after urine test, usually we see no infection. Or we say it may be psychological, maybe you are drinking too much water. You have to change your way of life, but this is not true. This is not true. There is some other different things. So I learned it from my patients who are having this treatment in all Soviet countries, Russia, Moldova, Ukraine, and all Soviet countries have different treatments for that. They always think there may be the disease may be hidden in the prostate. When I think about it, it is logical. I learned it from my patients and they want me to do prostate massage to themselves. When I do prostate massage, which I learned from the Soviet doctors, there is always secretions coming out in these patients. As you have, now you have maybe 4 or 5 drops of secretions. And when we tested your urine, there was no problem. When we tested your urine, there was no inflammation, nothing. But when we tested your secretion from the prostate, we saw there was leukocyte infection. You see it and I see it. And after the prostate massage, when you sit here, do you feel some kind of relaxation?
Yeah, better than.
How can you explain this?
More relaxed. I think the pressure is not that much.
Yeah, because there was some fluid inside the prostate. It was affecting the capsule, extending the capsule of the prostate. Now it is decreased. The pressure inside the prostate decreased. You will feel better now, but it is not the complete solution. We have to do this prostate massage 5 or 6 times. So I will call you every day and we will do this video again after the finishing of your treatment. But this treatment is very helpful for chronic prostatic infections. If you look at the internet, Western medicine says there is nothing like prostate massage. It doesn't work. It's useless, but it is not useless. We have many patients. We learned it from Soviet doctors. I myself went there and learned by themselves. We are happy with it. And there are some Chinese. You are from China. And we have a Chinese doctor. He is doing the massage from external. The muscle, he says muscles are affected with this. He is doing external massage and we are trying to learn this one too. So it's very related to massage therapy and chronic long run therapy. I hope this will help you too.
So the one we did just now is internal, right?
Yes,
This
this
is
this is
external.
external. Just the muscles of the perineum muscles, around this area. He does the massage, and we did massage inside the prostate, over the prostate. Do you think? Do you have an expectation this will help you?
I think so. I
Yes.
think so. But I still want to know
Yes.
the problem with like you said, like infection, right?
Yes, this is why this happens. Usually, two reasons. One is exposure to sexual infections previously. This may be a reason. Sometimes my patients, they say, no, we don't have any sexual intercourse which is making infection previously. And these patients, cold is a reason. Cold exposure, working outside, having cold. Sometimes barefoot. If you walk with barefoot at your home, you can get cold from your foot. So this is also a reason. We have a couple of reasons, but I am sure when I looked with ultrasonography, I saw a swollen prostate. And when I examined, there is a fluid coming out. So it's a prostatic infection in our view. We will try to treat it like this way.
Okay. And by after, like you said, 4 drops, right? 4 drops.
Yes.
So
So
the size will be smaller.
Actually, prostate will get smaller. The swelling of the prostate will go away. It will be normal size, of course.
Okay, it's because of the 4 drops of that liquid.
Yeah, okay, but the prostate is like chestnut big, this big organ, not very big. So this 4 drops, and we will do a massage, and it will not shrink from a very big size to a very small size, but it will change. The nature of the prostate will change.
I want to check the word. I want to
Yes,
say,
please. Inflammation. This is inflammation of the prostate. Prostate infection, prostate inflammation, these are same words.
as I said, I checked because of the virus. I cannot go back to China. So I checked the doctor
Yes.
online.
Yes,
So they said the same thing. Okay, inflammation
yes,
inside the prostate.
yes. They have the same diagnosis.
They give me a suggestion
Yes.
about the medicine.
Yes.
Actually, they write down the name of the medicine.
Yes,
and
prostate medicine. We
they
give
send-
normally Western medicine give prostate drugs to relax the prostate,
Uh.
to relax the muscles, painkillers and antibiotics.
Yeah,
But Soviet medicine believes massage to get rid of this inflammation. We need a mechanical intervention. So this works better.
Okay, but also as we are doing the massage,
Yes.
I need to take medicine too, right?
Yes, sure. I will give an antibiotic and painkiller.
Because after they give me suggestion, when the 3 doctors they said
Yes.
no doubt is inflammation,
Inflammation. Yeah.
and they absolutely they write down different. Every person,
Yes,
each person they give different medicines.
Yes.
I took like let's say half a year. After half a year,
Yeah.
3 of them no work.
Didn't work. And what was the best medication for you about among these?
No, I cannot say because it has never solved the problem.
Yeah. Sometimes we give anticholinergics to make the bladder hold more urine. Maybe it helped you. It may be decrease your frequency.
They give me that medicine too.
Yes.
But,
It may decrease the frequency, but it's not a solution. We have to solve the problem at its root.
so I doubt what's the problem. They said every doctor said inflammation. But
This is again is a hypothesis. I think it is a prostatic inflammation. I did the massage. You pass these drops. We will see. You will experience. I am sure you will get benefit, but you will see if there is nothing. Of course, we have to maybe make more detailed examinations, like looking inside the prostate with a camera endoscope. There is a little chance for me there may be some obstruction in the channel. So if you don't get benefit from this, we will look inside. Sometimes we do it previously, before the beginning to therapy. We can do endoscopy, we can do it. Sometimes we do it after the therapy. So you had some relaxation. If you tomorrow, next day, you feel better, we will not need endoscopy. If not, we can do it.
Okay. So do we need to CT scan or?
CT scan shows nothing. It's always normal. It doesn't show the problem in prostate and urine channel. Your problem may be in bladder, prostate, or urine channel. These three organs, and it is only good seen with an endoscope. We can look it with an endoscope if needed.
Yeah, endoscope to see what is inside.
Yes, of course.
What's the name? They see it.
Now we test. Previously, you give urine, there is no leukocytes. After massage, we tested the drops. There was leukocyte. So this means inflammation. Sometimes there is bacteria, sometimes there is no bacteria, just inflammation. But the problem is inside the prostate.
Okay, the first one, the first color
Yes.
is for
Yes. Leukocyte. Leukocyte. To find out.
Because the color change a lot, right?
No, moderate. Sometimes it is purple deeply. The color changed too much. In your case, it's moderate. That means, I think, the antibiotics you used before, they cleaned the bacteria. But still there is some inflammation in the prostate because bacteria make some destruction inside the prostate tissue. And their normal prostatic fluids collect. And they make the irritations, they make your trouble. Now we clean them and they will fill again. So we will do this massage 6 times. And then the diseased part of the prostate will be healed. Okay, we will begin our treatment now. I hope this prostate massage will help you. And